Woohoo! We are live. All right. Let's see in here. Hey, and Julie. Hey, guys. I'm gonna get Michael in on here. Hello. Instagram Live. This is so fun. So many great names. Hey, guys. All right, I'm gonna grab Michael. Join us. Let's see. Yeah.
What's up?
Here we are.
We made it work.
We made it work. We'd love to just say to everyone that this is Michael's second time logging onto Instagram ever, which is so awesome. Not only is he getting on Instagram, but Instagram Live,
It's a big
which is
step.
so fun. Big step.
Big step.
Big step. That's right. Are the kids in bed?
You know, something interesting has happened with bedtime during this quarantine, in that it is getting pushed back further and further. So I think they are in the process of going to bed. But
That's what I keep hearing.
Yeah, but it's fun. It's all
Yeah.
good. They have eaten. They have bathed. So
There you go.
2 out of the 3 steps.
That's right. I know. I feel like I haven't even gotten myself on a good bedtime routine. So
Yeah.
lots of grace for this whole process.
No doubt. No doubt.
Yeah. This is awesome. Well, it's so good to see so many of these names on here. Thanks, guys, for joining us tonight. We just wanted to get on and connect and kind of just share how COVID, it's obviously impacting all of us in so many different ways. And so we just wanted to get on and be able to share kind of what it's looking like right now and in the countries where we serve, and kind of share some ways that we've been kind of adjusting to the need, and some ways that you all can get involved with us in this time. So for those of you, I'm sure there's a few people who are on here with us tonight that maybe know only a little bit about OneWorld Health, or maybe don't know too much. So just kind of to give a little bit of an overview. So OneWorld Health is a nonprofit. We are based in Charleston, South Carolina, and we work in the countries of Uganda, Nicaragua, and Honduras. So between the 3 of those countries, we've got 13 healthcare facilities, and they are all self-sustaining and locally run and operated. So we have over 180 staff within those 3 countries, and they blow us away day by day, just the way that they serve their communities and the leadership that they hold there. I know there's plenty of you on here that have been able to interact with them and been encouraged by them over the years. So we also have a volunteer program, and so we send anywhere from 12 to 14 teams a year, kind of week-long outreach trips that go into the more rural areas in the areas that we serve. And then we also partner with academics and do short-term rotations with medical students, PA students, and pharmacy students. I see some of you on this list that have gone and spent a month at a time with our wonderful staff over there. So just to do a little introduction, my name is Amie York, and I am on my 5th year with OneWorld Health, and I, alongside Kim Mitchell, run our volunteer program. So like I keep saying, there's so many of you on here that have been on trips with us, and it's making my heart burst, which is awesome. So, and I also have Michael O'Neill with us tonight. So he is our executive director. Michael has been with OneWorld Health since the very beginning. He and his wife, Amanda, who I see on here also, they lived over in Uganda when we first started our projects there. So it's a wealth of knowledge, a wealth of experience. And so he'll start just tonight, just to kind of let you all know kind of status of each of the countries where we're serving, and then just some ways that OneWorld Health is responding.
Yeah, thanks, Amy. And guys, for everybody that's on here, thank you so much. And for so many people that probably aren't on here, we obviously would not be able to do anything that we do. We wouldn't be able to have the impact that we have and support the incredible local staff that we get to support without partnerships with all of you guys, from a volunteer basis, from a funding basis, from a corporate partnership basis. We are eternally grateful for all that you do to support our mission and vision. So yeah, like Amie said, we just kind of want to connect, and we've been trying to stay on top of getting emails out to folks and spending a whole lot of time on the phone, just connecting with people, letting them know what we're doing to respond and what things look like on the ground in Uganda, Nicaragua, and Honduras. But just thought this would be a great platform to connect a bunch of people at the same time. So by no means is this the last time that we're going to do this, nor is it kind of the only channel for communication. So if you've got questions after this, reach out to Amie, reach out to me, to Tyler, to anybody that you know on the OneWorld Health staff, and we would love to chat and just kind of bring you up to speed with what we're doing and kind of talk through ways that we can keep people engaged. So I'll just start off with real high level kind of overview of what's happening. Probably maybe the best thing to do, Amie, is to go through one country at a time and just kind of talk about where we are and then talk about how OneWorld's responding in that space. And so we'll start with Uganda since we've been there the longest. So as a lot of you guys know and have visited, we have one regional referral hospital in Uganda in Masindi Katara Medical Center. And then that's surrounded by 3 more permanent facilities that serve as kind of referral points to refer back into the hospital there. And so we got about 100 staff more or less in Uganda that are treating thousands and thousands of patients on a monthly basis. And it's been really fun to see that grow. The country as Uganda has responded really has taken a proactive approach. We've been really impressed and very pleased from a public health standpoint and how they've responded to the pandemic and what they've done proactively to mitigate some of the transmission of the disease. And so since the beginning of this month of April, they've shut down borders. So the only thing that they're letting across borders right now are cargo. And all those drivers are being tested currently, which is really exciting. They've shut down all flights and land borders as well for folks traveling in and out of the country. The other thing that they've done is since the beginning of the month, they started with a 2-week full lockdown. So it's a lot more strict than what we're experiencing here in the U.S. In most states, but it's just a full lockdown. So they've suspended public and private transportation. All businesses are closed with the exception of just a handful of truly essential businesses. So that would be things like healthcare, obviously, for us. Some of the pharmacies are open, the banks are open, and then the utility companies, and that's about it. There's some grocery kind of stores and little small markets that they've kept open to obviously continue to provide food for folks. But the big open air markets, if anybody on here has been to Uganda before and have seen the big open air markets, they've really shut those down. So the good news that's coming with all of that is that they've tested about 8,000 people thus far. This is through yesterday, I think. 55 positive tests. 50 of those cases were imported cases. So they came in through flights or whatever it might be. And then 5 of them were what they would consider to be local cases. They're tracing about 600 people that have come in contact with folks in the country right now. But one of the things that a lot of public health officials in country and out of country are pointing to, Uganda specifically, is that they haven't really done community testing. They haven't done a big group of community testing in the country. And so the hope is they've been working with CDC Africa, they've been working with WHO. There's a lot of testing in country now. And so the hope is over the next couple of weeks, they've extended that lockdown now through May the 5th. So they put 2 more weeks on it. And over the next couple of weeks, they will really start to do some mass testing in the country and use that data to make some decisions on when they start slowly phasing the economy back in Uganda. So that's on the good news side. The bad news side is that we all know Uganda's healthcare infrastructure is incredibly fragile. There are less than 55 functioning ICU beds in the country. It's a country of over 36 million people. It's a very collectivistic country and culture. A lot of folks living together. And so this idea of social isolation, while they're doing their very best and trying to still survive, it's a really hard concept, just the way their culture and their communities are set up. So there's kind of some fear around how quickly this thing could take off if it starts to spread rapidly in the country. And so there's some real concern around that. Obviously, the economic distress that this is putting on the economy of Uganda is really tough. There's some indications out there that there'll be at least a bare minimum of 1% drop in GDP for the Ugandan economy, which will push over 1 million people under that international poverty line. And so there's already I don't know, I should probably know the exact number, but a few million people living under international poverty line now. This pandemic will push another million plus back into that space. And so a real need to respond to health, a real need to respond to economic concern in the country right now. So that's kind of where we are as an overview of the country. And then, Amie, I don't know if you have questions or if people are putting questions up. Otherwise, I'll just kind of go into what our response in Uganda has been.
Yeah, so I haven't seen any questions, but that's a great point. So as Michael's kind of giving an update, feel free if you have any questions to send them just in the little comment box, and we'll definitely address those. So you're welcome to just keep going with our ways that we're responding right now.
Cool. I'll jump in then. So I'll preface all of this with this. I think hopefully you guys know us, our hearts, the heart of this organization, which is 100% to be there to serve the least advantaged of our brothers and sisters across the globe. And, it's our mission to provide quality, affordable care to communities in need. And we feel like there is no time like the present to live that mission out fully. And so we're leaving no rock unturned. We're going to try some crazy things. I think a lot of them are going to work to really serve people, and we're going to try some stuff that maybe doesn't work, but we're going to do it all with the heart of just serving these people that we love so deeply and we've grown to know in the communities that we serve in Uganda over the past 10 years. And so we have a 6-prong approach or response to what we're doing in Uganda. And so probably the first thing I'll touch on, and maybe one of the most important things, one of the most salient things that we're doing right now, is we're putting a lot of effort into more fully funding and developing our patient support fund. And so we work on this chassis, on this foundation of operational sustainability day in, day out. And that's what has made our projects so successful over the years, is that they've been self-sustaining. Well, that shifts right now. We all know how much the economy's been affected here in the U.S. You can imagine such a fragile economy in Uganda, literally sustenance farmers. So many of these families, if they don't go to the market to sell what they've harvested, then their kids don't eat. That's just the harsh reality of what's going on right now. And so we're having to shift a little bit right now in what our service delivery looks like and how we're interacting with the patient population to do that. So we're spending a lot of time working with donors, working with partners to make sure that we're building out a very robust patient support fund so that we can support folks in the midst of this time, not only in response to COVID, but obviously malaria is not stopping, TB is not stopping, pneumonia is not stopping. The rainy season has just started there in Uganda. And so historically, and we can predict that by all kinds of data, that we will see a massive increase in malaria cases happen in the coming months. And so we're working really hard to support that. We've turned an isolation ward, we've turned a space in our facility that was scheduled to be open and be a physical therapy and occupational therapy space. We expedited construction on that when we saw this coming a couple of months ago now, and got that completed, and we've converted that into an isolation ward. And so what we've done there is put 32 new inpatient beds there that have oxygen support, just knowing that region could see a lot of cases, and we want to be there to help support the community there, the Ministry of Health, CDC Africa, anybody that we can be a part of this kind of group response. We want to be a part of that. And so we were able to acquire 32 new beds and oxygen concentrators to kind of support that, and are able to move staffing around in a way that we know we'll be able to provide support and care to folks as this thing takes root, if it takes root. So staff preparation is another huge thing that we've done. Thankfully, under the advice of co-founder Dr. Ed O'Brien, who has been really leading the efforts in a lot of ways here in South Carolina and domestically, had us on the front end of this. And so we were able to get ahead of the curve prior to those supply chains really tightening up. And so we were able to get all kinds of PPE gear that was needed for our staff, get that equipment I was just talking about, making sure we've got the medications that we need on the front end of this to be able to walk through it and kind of bridge that gap. And so we get to the other side. Super grateful that we've done that. A lot of developed nations have actually put some pressure on some developing nations to get supplies out of those countries into the countries as it's hitting the West prior to hitting a lot of the developing countries. And so those supply chains that I was referencing earlier have totally tightened up. And a lot of our counterparts, folks that we're connected with in country, have been working really hard to get that stuff. And so we're really thankful that we have those things in place so that we can protect our staff, because we all know we're only as good as those frontline healthcare workers. And our staff is incredible, some of the best practitioners in Uganda, and we are incredibly, incredibly thankful for them and want to make sure we are doing everything in our power to protect them, to put them in a place to serve folks when they need it most. And so we're really, really thankful for that. Couple other things that we've done that then I'll talk about. One of the most exciting things, which is something that we'll roll out in Uganda by the end of the week, but at-risk patient protection. And so we've created an off-site space for folks to come so that they're not coming to the hospital and they're not coming to the clinic. So this is folks that HIV infection rate is pretty high amongst adults in Uganda, hovering around 6% currently, I think. We're able to offer an off-site space for them to come to receive the ongoing care that they need. And for the elderly and immunocompromised folks as well, we want to do everything we can to keep them away from other people that are coming in with other diseases, and making sure that we test them, we're able to treat them with whatever it might be. And so we've created a place that's off-site that's more sanitary and just more separated for them. And then public health and partnership initiatives. So we are constantly working with the Ministry of Health, working with the CDC, NIH, WHO as they're coming into our region, working with all the other entities and healthcare providers around us to make sure that we're really responding in a unified approach there. And so while the Ministry of Health are the only ones that are disseminating information currently, we are working with them to make sure that we're supporting them in every way that we possibly can. And then something that's exciting for us is that by the end of the week, we will have launched a telehealth platform in Uganda. So this is something that was in the works a little bit before all this started, and we've certainly expedited this process. And so we've all seen how important telehealth has been in responding to the pandemic here in the U.S. And we certainly want to follow suit, keep our staff protected as we possibly can, and keep the general public, the community, and our patients informed and connected to our clinicians and our providers, but out of the space when at all possible. So.
Yeah, that's so awesome. So we do have a few questions on here. Joe is wondering if we have a ventilator at our hospital.
We currently do not, no.
All right. And then I don't know this first name, but we've got the question of how are we protecting our healthcare workers in the facilities? It seems like a big challenge here in the U.S.
Yes, touched on that a second ago, but we're doing everything we can from a PPE standpoint, and then from a cleaning and sanitation standpoint. We have implemented all kinds of new processes. We do CMEs on COVID specifically multiple times a week now for not only our clinical staff, but our sanitation and administrative staff as well. So, man, we love those guys more than I can tell you. And we are doing everything within our power to make sure that they're protected. There certainly are challenges and will be challenges just as there are here, but we're certainly doing everything we can.
Yeah, that's awesome. So just to give a name too, so we've got Dr. Dennis over there is our chief medical officer. So he is really leading great. And then we've got Patrick as well, who's our regional admin. I know some of you have been able to spend time with them and meet them, and have, as we are, just been blown away by their leadership and care, and the ways that they care for each other, for the patients as well. So keep them in your thoughts and prayers as well. You want to go ahead over to Nicaragua?
Yeah, so Nicaragua is a little different story in terms of what they're doing from a government standpoint to respond to this. The government in general has been incredibly lax in responding to this and putting any process or controls in place to mitigate transmission. If anybody's more interested in why that's happening or how that's happening, we've got all kinds of articles and offline, I'd love to talk about it. So officially what has happened in Nicaragua is that they have officially confirmed 10 cases as of this morning. 6 of those have recovered. 2 of those are still hospitalized, and 2 of them resulted in mortality. Now, unofficially, those numbers are skewed. Almost any public health expert out there, just based on what's happening in terms of transmission with all of their neighboring countries. There are estimates that between 1,000 and 5,000 cases are in the country nationally at this point. Nicaragua officially has not closed down any of their borders. They have not implemented any kind of lockdown strategy or social distancing. They've done some things that are certainly concerning to us from a public health standpoint, but those numbers officially are really low right now. We all assume as some more reporting comes out, more data comes out from mortality over the past month, that we're going to see a lot higher mortality coming from, pulmonary diseases, from some undefined deaths that everybody assumes will be tied to the COVID-19 pandemic across the globe. And so same kind of deal there in terms of our staff just being top notch, right? And us doing everything that we absolutely can to protect those guys. That was the first thing that we did in Uganda. First thing that we did in Nicaragua was to make sure that we acquired PPE for them, that we put new protocol in place for cleaning facilities, and that we created patient flow processes to help make sure that we're mitigating exposure as much as we possibly can. So, the other things that we've done in Nicaragua, they're going to be very similar to what we've seen, or what I just referenced that we've done in Uganda as well. And so the Patient Support Fund, another big deal. As a lot of you guys know, if you've been to Nicaragua or you've been following along with OneWorld, the work that we've been doing in Nicaragua, almost exactly 2 years ago in April, there's a lot of political unrest that really led to a downturn in the economy there, to put it lightly. And so they're just on the heels of that, maybe starting to make a little bit of an upward swing in terms of tourism opening back up and some funds flowing back through the country again. And then this hits, right? And so they're in a very dire economic situation, as is Uganda, as is the global economy at this point, but really hitting people in a tough spot right now. And so working really hard, again, with donors, with partners, to make sure that we start to build up that patient support fund so that we can support these patients in these communities that we love so dearly in Nicaragua as this thing continues to take root. Staff preparation, I referenced earlier. If anybody has specific questions on that, we can respond. In Nicaragua, it's all outpatient facilities for us, and so we don't have any inpatient there. And I should say that the Ministry of Health in both Nicaragua, Honduras, and in Uganda, all are mandating that all COVID cases or possible cases are referred directly to government facilities, right? And so at this point, we actually don't have clearance from the Ministry of Health to treat any of these cases, but are working really hard to identify them and then refer them through the appropriate channels. At-risk patient protection, what we've done in Nicaragua is because we're in so many different communities there, we haven't created a centralized space, but we've created spaces outside of all of our facilities. So as patients are coming in, if they're presenting with any possible COVID symptoms, then they're being, same thing that's happening here. Like I was out the other day, I had to take something by the OneWorld Health office to drop off, and went by a couple urgent care facilities, and there's like a guy out at a table in front of the facility, right, meeting patients as they come in before they get inside the facility. And so very similar protocol and change in flow and how we're interacting with patients there. We also we're able to do a little bit more public health and partnership initiative in terms of disseminating information in Nicaragua, just kind of how it's opened up. And so we've got a few different campaigns happening on social media, happening with the megaphones. If anybody's been to Nicaragua, they know that's the primary channel of communication, is guys riding around on three-wheeled motorcycles screaming out of a megaphone. And so we've initiated a few campaigns with that, working with all of our corporate partners and church partners and ministry partners, all the folks on the ground there, just to get them the most up-to-date information as we have it, so that they can get that connected to their networks. And so we feel like, or we know that that's a big part of this public health response and making sure that people are getting correct information. And then the telehealth piece, super excited to announce that this rolled out in Honduras and in Nicaragua today on Monday. So a quick turnaround for us on this. We're able to use our clinicians that we have staffed at all the facilities there, interacting, not only just answering questions about COVID, but again, answering questions about hypertension or whatever chronic disease somebody might have, or even a trauma that somebody might have experienced and they need some help deciding whether it's safe for them to go to a facility or they need to go to a facility. And what we're doing, I failed to mention this on Uganda because we're still working out a few kinks, but is a home delivery system as well. And we have that already in place in Nicaragua and Honduras. And so as we're having conversations with folks, trying to keep them in their homes, we're able to send prescriptions and medication and some treatment options to them to their home through motorcycle delivery, which we're really excited about. Just an opportunity for us to support folks during this time.
That's awesome. So we had someone ask if we're using fireworks too, which just makes me very happy because of course they know how to celebrate.
Yeah, that's somebody that's been there
fun.
for sure.
Yeah, for sure.
We will. A celebration with fireworks is coming.
Yes, that's right. Someone did ask to elaborate a little bit on the telehealth program. Maybe you can just do a little bit more, and then we can learn. We're obviously happy to follow up with you more if you want to hear.
Absolutely. Whoever asked that, please reach out. Would love to talk to you. Really, it's a teleconsult platform for us at this point. And so if anybody is familiar with Dr. Ed O'Brien at the Medical University here, he's a co-founder with Matt Alexander of OneWorld Health. And Ed has really been leading the telehealth charge and a lot of the COVID-19 response for the state, for Medical University, and subsequently for the state of South Carolina. And so he's been instrumental in helping us create the platform for this. Obviously, these things look different in the country context where we are and where we're operating. And so a lot of our platforms are built off of WhatsApp because it's a cheaper way to communicate in these countries. And so we built it off that, as well as a whole bunch of different phone numbers based on what company you're working with, because airtime's cheaper company to company. And so just making it as affordable as we can for folks. But it's just an additional consult. We've developed a very specific process and algorithm, I guess is probably the right word, for folks to walk through in a diagnostic standpoint for COVID specifically. And it'll point to whether or not somebody needs to come in and be seen, whether they need to self-isolate, whether they need to go directly to a Ministry of Health facility, whether they need to come into one of our facilities. That's on the COVID side. And then have just built out a very, if anybody's used telehealth here in the U.S., it's a very similar way that, as opposed to it just happening on the computer in Uganda and Nicaragua and Honduras, all of these questions are happening over the phone. Although there is an opportunity in Nicaragua and Honduras for that to happen via a smartphone or a computer, we anticipate the majority of these things will be happening with direct interaction with our clinicians as they kind of walk through the process and are asking folks these questions over the phone. And then it will come to a place where they can respond appropriately from a clinical standpoint. So whoever asked that, I could talk about this stuff for hours, and we can send you a bunch of documentation on it. So please reach out.
That is so cool. And then I'm just going to give names as well. So Daniela is our Director of Operations in Nicaragua, and Dr. Roberto is our Medical Director down there. So again, keep them in your thoughts and prayers as well during this time. So it's Daniela and Dr. Roberto, and then obviously the rest of their staff. Honduras.
Yeah, so Honduras, hopefully everybody knows, but we announced Honduras not too far in the past that OneWorld Health would be expanding into Honduras, and this has put a little bit of a curveball in what our plans were, obviously, for building out facilities there and starting to offer services, but in no way has it slowed our commitment or our response to what's happening there. In some ways, it's expedited it because we recognize in Sigua, in the place that we're working, with an incredible partner there called Serve Hope International, that there's a massive healthcare gap in that area, in that region, and that's why we're going there, right? And so we wanted to, in the same way, figure out a way that we can respond, even though we don't have facilities in place yet, even though we don't have a robust clinical staff in place yet. We wanted to make sure that we're serving these people, these Hondurans that we're growing to love and to know, and responding to a need that's there in the community that's very evident. And so, overview of Honduras, there have been 477 cases there, 47 deaths, and 25 recoveries. That was as of this morning. Honduras has, again, been very proactive in their response, as Uganda was, and continues to be. Honduras has implemented very strict lockdown policy. Same kind of thing. So every essential businesses are the only thing that's opened. Big open air markets have been shut down. People are able to go out to grocery stores and to supermarkets, but that's all done by your social security number. And so if your social security number ends in a certain number, you're able to go on a certain day to get the things that you need one day a week, and then that's it. Other than that, when we talk about a stay-at-home order, it's a true stay-at-home order. One person from each family is designated to be able to go out, and you have to show your cedula, you have to show your social security as you're there, and prove that it's your day to be in the supermarket. They're taking these precautions very seriously and implementing social distancing in these markets. Carlos, who's there with us and leading our efforts there, has given us in great detail what that looks like. And we're happy that the government's responding in that way. Same kind of thing on the economic side of things. Obviously, the businesses that we're connected with and other organizations that we're connected with are taking a big hit as the economy is essentially shut down. So borders are closed in Honduras as well. And then our response, like I said, is around the public health side of things. For sure, we're working with our partners, our ministry partners, church partners. Serve Hope is a great partner there. Working with the local Ministry of Health to make sure that we're disseminating the exact information that they want to get out in regards to COVID, and what the response needs to be, and precautions that folks need to take on a daily basis for this. And then we launched in Honduras today our telehealth platform as well. And so I just talked about that some, but very similar. We're able to contract a clinician there who was in line to be our first clinician at our first facility, and we're able to bring her on sooner than later, which we're excited about, to serve the community where we are, and make sure we're getting good quality information out there for them, and then just responding to other healthcare needs that they might have.
Yeah, amazing. So Michael had mentioned his name, but Carlos is the one that is leading our efforts there in Honduras. So Carlos is the name you can be thinking about and praying for down there. So awesome. Well, all of this. So I guess let's go ahead and just talk about some ways that people can be a part of what we are doing right now. You know, volunteer teams are currently on pause. And so we have postponed or canceled all the trips through July. And so as soon as we get the word that it's great for us to travel again, we will be doing that. And we'll make sure that gets announced as well. And so I know that we'll be very glad to have you then. But in the meantime, Michael, you want to go ahead and explain some ways people can get involved?
Yeah, absolutely. So guys, one thing that's been incredibly moving for me throughout this whole thing is just the way that true heroes, healthcare heroes, right? Like, it sounds a little bit cheesy, but like it's true. Like, these people that are battling this thing on the front lines have become the most important people in our society. And our society as a whole, not only domestically, but globally, I think, is just lifting these folks up, lifting up the sanitation crews that are cleaning hospitals, and the nurses and the doctors and the PAs and the clinical officers and all these folks that are providing care to people that need it. And so for everybody out there that's working in that field and in that space right now, from the bottom of our hearts, we want to say thank you. And that includes all of our staff in Uganda, Nicaragua, and Honduras. We love you guys. You guys are out on the front lines fighting this battle. And if we can just hold your hand up in any way, that's what we want to be a part of doing. And so the first thing I'll just say very bluntly for everybody out there, if you'll pray for those folks domestically and internationally, please commit to that and be a part of that. We are certainly doing that, and would love for you to join us in that process. The other thing that we're working on, and we'll send out an email to follow up on this, but we're working on a little platform where you can send videos of encouragement to our folks. And guys, when I tell you we have people that are like walking across rivers and walking miles and miles and miles every day to show up, to put their life in danger, to serve other people, that's what's happening, right? So in 2 of the 3 countries where we're working, it's against the law to drive a car right now. And so the solution has been that our staff is walking to work, which is insane. And so it's taking them a long time to get to work, to put themselves in harm's way, because they're committed to these values that we have of service and humility and integrity, empowerment, love, and dignity, and just serving people with all that they are and putting people before themselves. And so many people here in the U.S. are doing that as well. So many volunteers that have come with us, obviously, are in the medical field, are clinicians in some form or fashion. So to you guys, thank you. And if you want to send a video just to our staff in Uganda, Nicaragua, Honduras, anywhere, get your kids involved, get your family involved, be silly, be funny. Everybody loves to laugh. They will definitely be laughing at a bunch of Americans trying to speak Spanish or just at your accent anyway. They'll be laughing at you, which will be fun. Probably not with you, at you, and we're okay with that right now. So Amy's probably the best contact person for that, and making sure we get all that stuff every day. We just want to have, as people come into work, that we're sending them these videos and they're able to see that they're loved and supported and not forgotten from across the globe, certainly from the OneWorld Health family. So please join in and be a part of that. So those are 2 things. A couple other things. I know a lot of folks are in crazy financial situations right now. But a couple other things that we're doing just on a broad level to help support our efforts on the ground and our response there. And one is this patient support fund that you've heard me talk about all night at this point. And so $5 is kind of what the ask that we're making right now during our response to this. What we're talking about is that provides access to a clinician for a patient, for us, whatever it might be, and for us to be able to supplement that so that they can receive services, very much needed services is a really big deal. So I think we're going to have a follow-up. We're going to roll out that campaign a little bit tonight, and folks will have an opportunity to respond to that. Amy, you can probably speak to it more than I can, but as little as $5, goes a really long way for these people that we care deeply about right now. And then the third thing, Amy, you can speak to this. I'm obviously not the fashion guru on this call between the 2 of us, but Amie and our crew, the fashion relevant crew at OneWorld, and with the blessing of the most incredible partner we've had in for a decade at this point, Need to Breathe, put together some merchandise, some Forever on Your Side merch with t-shirts, I think, and maybe a hat or 2 and a long sleeve shirt or whatever's on there. And every penny from that campaign goes directly to supporting our response to all 6 things I've been talking about tonight in all 3 countries. So.
Yeah, awesome. So I just put in the little comment box, a way to kind of give to that patient fund is to text OWH COVID to the number 41444. And then, as Michael said, we do have the t-shirts, sweatshirts, and a hat. And so we also want to shout out to Wimberly, who she was on here for a minute, but she's with Booster, who's helped us get that whole online merch rolled out, which is awesome. So it is Forever on Your Side. So one of the Need to Breathe lyrics, and I think just really kind of encompasses our commitment, right, to the place that we serve. And so just saying, like, we're forever on your side. And so please check that out. And then, as Michael said as well, we'd love to send videos. And you can simply just do a little clip, 1 to 2 minutes. You can send it over to us via volunteer@oneworldhealth.com. So all 3 of these things, as soon as Michael and I get off here, we're going to go ahead and just post them with all those kind of instructions there. So you don't have to remember all of these things I just threw at you. But please get connected with us in these ways, and we're just really thankful for all of you. So thank you from OneWorld Health to you. Awesome. And then, Michael, do you have anything else to wrap us up?
No, yeah, just honestly, thank you to everybody for all of your support. We do not take it lightly. We don't take the
Mm-hmm.
way that you engage with OneWorld Health and our mission and our vision lightly at all. And I promise you, we are 100% sold out to responding to this thing with everything that we got.
Mm-hmm.
Um, I get emotional thinking about it. We are 100% committed to it, and we are going to walk through this with our brothers and sisters across the globe, and with all of you here. And so, yeah, thank you from the bottom of our heart.
Awesome. Alrighty. Take care.